Hey, tēnā koutou katoa. Welcome, everybody. Good morning. Malo le suifua. My name is Hine Moaki, and I'm with Waitakere HealthLink. And today I have the honor and maybe even the challenge of facilitating our meeting together. So yes, welcome along. I am going to start. We're going to start on time. And when I mention challenge, that's probably what I'm referring to the most, because there's so much valuable information. There's so much to hear and share, and we're going to be running the meeting quite tightly today. So I'm going to start with karakia on behalf of us all. Me inoi tātou, let us give thanks. Manawa mai te mauri nuku, manawa mai te mauri rangi. Ko te mauri kai au, he mauri tipua, ka pakaru mai te pō, tau mai te mauri, haumi e, hui e, tāhiki. Kia ora. Thank you, everybody. Wow, what a great turnout. What a great turnout. So congratulations, Tracy. Again, my name is Hine Moaki, and I am from Waitakere HealthLink, and it's my role here today to keep us moving, to make sure that everybody who is on the agenda has the opportunity to share what they have brought today. So in the spirit of that, in the spirit of everybody getting the opportunity to be heard and to speak, we are going to, as you would have seen in the agenda, run things very tightly. So 2 minutes. And Tracy, can you put your hand up there, please? Kia ora. Tracy is in charge of the all-powerful mute button. Mute button. Kia ora. So, yeah, I can already see some laughing and some acknowledgement of that. That's a tough job. So please know that you have 2 minutes. And if you haven't had an opportunity to say everything in that 2 minutes, you'll have an opportunity in the follow-up. Okay, so kia ora, Tracy. Thank you very much for that. I would like to acknowledge Kay, David and Samuel from Waitakere HealthLink, and there may be others, and Zari, and there may be others, but I can't see you all on the screen, so I will be going back and forth. Kia ora, kia ora. So we have a lot to get through on the kaupapa today. We're going to be hearing from long-term conditions first as a group, and I will read out the order of speakers. And then I will ask you, if I call your name out, to put your hand up, okay? And then you will come to the top of the screen. However, before that, we would love to see the staff. We would love to see who are the staff from the DHB that are in the room today. I think there's something going on in the chat. Kia ora, Zaira. Yes, ka pai. This is how we're going to find out who you are. In your reaction button at the bottom of your screen, for those of you who haven't used Zoom or aren't familiar, the reactions will allow you to put your hand up, to smile, raise your hand. Can you see that in the reaction? If you are a staff member of the DHB, could you please use the reaction button to raise your hand, and then we will be able to see you at the top of the screen. Kia ora, Samantha. Ka pai. Awesome to have you here, Samantha.
Kia ora.
Kia ora. Welcome. And we may have an opportunity to let you introduce yourself about halfway through the agenda, Samantha. If you need to leave before that, please let us know. Ka pai. And who else? Any other staff here that can raise their hand? I think it was Zaira. Zaira, yeah, public health nurse and children and family services. Oh, I don't have my mic on. That's fine. Thanks, Zaira. And Sonia, you've got some technical issues. Kei te pai. We've all got technical issues in this Zoom world, and we're going to work together respectfully and in the spirit of kindness to make sure that we all get done what we need to get done today. Is it Danya? Beautiful. Kia ora, Danya. Welcome. Welcome.
Hi, good morning, everybody. I'm a gerontology specialist based at North Shore Hospital, work in community and residential aged care services.
Wonderful. Well, enjoy the kōrero, the discussion, the today.
Thank you.
Right, the talanoa. Okay, thank you very much. So we're going to get started. You okay, Tracy, to do that? Shall we get started? Anything else, Tracy, that you'd like to mention before we get going?
Nothing from me.
Nothing from you just yet. Okay, kia ora. We're going to start off hearing from the group of services, community services that are in the long-term conditions. So if I read your organisation name out, can you please raise your hand and you will go to the top of the screen. So Dementia Auckland, if you are here, please raise your hand using the reactions. Nicola. Thank you. Diabetes, New Zealand, diabetes. No, okay. Auckland epilepsy. If you could just raise your hand if you're in the room. Lynn, great, thank you. Hospice, West Auckland. Please raise your hand. We've got a lot of people in the room today. Kia ora, Dan from Hospice. Parkinson's, New Zealand. Thank you, Rachel. And we have an apology from the Wilson's Trust today. Stroke Foundation New Zealand. Please, if you are in the room, please raise your hand so we can see you and get ready to hear from you. Stroke Foundation New Zealand. And that's us to get going. So again, no mai hara mai, warm welcome. Let's do this together. Let's hear from Nicola first. Is it Nicola? From Dementia Auckland. And are you ready, Tracy? Nicola, where are you, Nicola? Nicola? Here. Can't find reactions. Sorry. Nicola, that's fine. There you go. You found it. You're clapping. Awesome. So, Nicola, we are going to time you, and, you know, there is going to be a mute button. So, it's all your time right now, though. Kia ora, Nicola. You're on mute.
Hi everybody, kia ora. My name's Nicola, I'm from Dementia Auckland. I'm the key worker for the West Auckland area. We are all over Auckland. There's 9 key workers. I support families and people who are living with dementia. We accept referrals from all sources, including families themselves. We do need a carer to work with and talk to, so just bear that in mind when you make a referral. We offer home visiting, ongoing support, phone consults. We offer a Living Well program. We have walking groups operating at the moment. They are quite scaled back due to Omicron. Once we get past this wave, we'll open up more of our groups, which will include things like singing groups, cognitive stimulation therapy for people who are in the mild to moderate range. But right now, it's just walking groups for the people living with dementia. We also offer education to family and whānau. We have a 6-week program that we are offering by Zoom at the moment. We have a side-by-side education, which is where the person with dementia, as well as the carer, can come together to learn. I also run 5 support groups in the community for carers, for people who are in the business of looking after somebody with the dementia. They are now open and we are back to face-to-face. We're rat tested and triple vaxxed.
Okay, so there you go. It's in action, everybody. That was our first go at that, Nicola. So, Nicola, what I'm going to say is thank you. There's so much, and there's always going to be so much more, everybody. So what I'd like you to do is, if you would like to connect directly with Nicola, use the chat box, okay? Use the chat box to send a message directly. If you look in the chat box, it says everyone. If you click on the blue drop-down box, you can talk to a person in this room, okay? So, and Tracy's going to be sharing a lot after this. Ka pai, thank you, Tracy. Thank you, Nicola. All right, Rebecca. Rebecca from Diabetes. Kia ora.
Hi, I don't know if I'm at the top or anything. I can't find the reactions. I apologise. But you can hear me all right, eh?
Yes.
Yeah, that's good. So hello, everyone. I'm the West Auckland Area Coordinator for Diabetes Auckland, and currently, even despite pandemic, we're in the middle of expanding, as I spoke briefly on in November with the last meeting. It is a slow process because of the situation that we're in currently. However, we are trying to get more wider spectrum of support and welfare to diabetics in the West Auckland area, also in Central, but at the moment the focus has been on West, just due to the general compactness of Central Auckland. It is easier for people to get around to facilities compared to the West Auckland situation, especially Ranui, Swanson, some of these other areas. We've got One Lady in Parau now in a lot of need. So yeah, so we're in the middle of all that and we're working on it, and we're still looking for people to network with to learn about what their needs of their people are that might be diabetic. For example, the lady before me, people with dementia who also have diabetes, that we might be able to help bridge the gap of some of the problems that can occur from that. So yes, I'll put my details in the description and we'll be able to talk more about some of the things coming up.
Awesome. Thank you so much, Rebecca. Thank you. Using everything that's available to us, the chat, all of that. So yeah, and I can hear the connections already. Ka pai, so Rebecca, we've got Auckland Epilepsy now, and that is you, Lynn.
Good morning, everybody, new friends and people I haven't yet met. Kia ora, my name's Lynn Williams and I am the educator for Epilepsy New Zealand. My area is Waitakere DHB, so I look after all of the North Shore and West Auckland. My job entails working with a lot of organisations, Spectrum Care, Idea Services, training their care workers or their home support people to handle a person's seizure, to help maintain stability around seizures and things like that. I do a lot of my education in schools where we can tailor what we do to a specific child. Daycares, we do home visiting, advocacy for people, excuse me. And generally we try really hard to get the word about epilepsy because it's a condition that is transient. Not a lot of people know a lot about epilepsy, but we try and hold seminars, which unfortunately, because of COVID, haven't happened. We have a youth group where younger people can connect with each other if they have epilepsy. And generally, we're going to be supporting Purple Day, which is the 26th of March. That's to raise awareness throughout the world. It's an international celebration for people with epilepsy who otherwise wouldn't have a voice. And would not be recognised so much in the community because of their condition. I'm happy to put my details in the chat for anyone who wants to contact me. We do take referrals. All I need is a phone number and a name, and I will contact the person directly and see if I can go and meet with them to offer education and support and advocacy. Thank you.
Oh, wow. Kia ora, Lynn. I did not know about that day, 26th of March, International Epilepsy Day. Thank you very much. We're getting good, folks. We are getting really good at this, aren't we, Tracy? We'll keep going. Ka pai. All right. So Dan from Hospice. Kia ora, Dan.
Hi, kia ora. Hi, my name is Dan. So I'm one of the nurses from actually the POI team at Hospice West Auckland. So because of Omicron, we've been modifying our services a little bit. So Hospice West Auckland is still running. We have our 24/7 phone helpline that's always staffed by someone. That's still going. We're doing a lot more virtual consultations and visits, and also just consults with GPs and rest homes for people in the community. And we are still doing essential visits. So people get obviously screened for COVID and things like that. So, but we are still going out when there's a need, and we're all, you know, triple vaxxed, and we can do rats if that's required. So with that's, so hospice, I'm sure you know, we do specialist palliative care for people who, you know, who are dying or who are in their last couple of months of life, but who have really complex symptoms and psychosocial needs. With the POI team, the Palliative Outcome Initiative, it's an Auckland-wide regional initiative, and we have a team at Hospice West Auckland, and we do a lot of education consultancy for people who are in the community that are under the care of the GP or facilities who are, you know, managed in the community, but they don't need specialist referral. And all our services are free.
Kia ora, Dan. Thank you so much. It's so good to hear that the service is still going and you're able to adapt. Kia ora, Dan. Thank you very much. So we've got Parkinson's New Zealand next, and that's Rachel. Kia ora, Rachel.
Hi, I'm Rachel Turner. I'm the Parkinson's nurse for West Auckland and Rodney. Parkinson's New Zealand provides education, information and support for all people with Parkinson's, Parkinsonisms, including their caregivers, friends and families. We take referrals from anybody, next door neighbours, people themselves, family, as long as the client themselves is aware as well. Otherwise it can be a bit of a shock. Currently under phase 2 red, we're back to virtual, no face-to-face, though we are reviewing that weekly. We're all triple vaxxed, and we have a separate lady, Debbie, who does the North Shore.
Kia ora, Rachel. Thank you. Thank you very much. Again, connect with Rachel in the chat if there's something that you heard that you want to follow up on. Ka pai. So Stroke Foundation New Zealand, are you now in the house? Are you now in the Zoom room? Just checking. 4, 3, 2, 1. Maybe not. Okay. Ka pai. We are going to, and we've had apologies from Wilson Home Trust. So because we have so many people to hear from, amazing people to hear from, we are going to carry on, and if you arrive later, potentially there won't be time. So there's still lots of interesting kōrero to hear and people to connect with. Is that okay with you, Tracy?
Yep, perfect.
Great.
Going good on time.
We're going well on time. Awesome. So everybody's going to get to have their kōrero. Let's keep going. So we're going to, after this group of services, we're going to move into the mental health and social services now. And we have about 6 organisations to hear from then. And then we will maybe hear from a couple of the staff who are in the room. Before we then move on to cancer services and support. Okay, kia ora, mental health and social services, please. When I call your organisation, could you just raise your hand? And then that will bring you to the top of the screen, which gives us visibility of you as well. So Changing Minds. Changing Minds, is that you, Jody? Kia ora, Jody, thank you. Problem Gambling Services, please. Kia ora, Shayal. Te ata, kei konei a te ata, is te ata here? Te ata. Oh, is that, no, can't see them yet. Okay, kei te pai, you might be here. If you're here, just bring yourself off mute.
I think it might be Zoe.
Zoe.
Oh.
Zoe?
Sorry,
Yep.
I didn't even recognize what it Itipueria Whānau Services.
Oh, e te puerea. Oh, nera. Okay. Aroha mai. I have te ata here. Kia ora, no mai. So we'll have Zoe, and then Walsh Trust. Kei konei. Jude. Kia ora, Jude. and then Waves Trust. Amiria, kia ora Amiria, and then Yellow Brick Road. Kia ora Sonia. Thank you all for being so onto it. You know, we got 2 minutes, so let's get going. Jody from Changing Minds. Kia ora, Jody.
Kia ora. I'm actually going to show you something because it will explain it a bit better. It's going to be 2 secs to pull this up. Here we go. And sorry, I'll just shift this down a bit. Okay. Let me just move there. Okay. So kia ora, I'm Jody from Changing Minds. I want to talk to you today about our Whakatomai digital library. Some of you guys will know about our Whakatomai program already. Oh, this is being annoying. It won't let me move slides. So Whakatomai, just have to bear with me. Whakatomai is a online wellbeing program that we have run. We were defunded. It was part of the government psychosocial response to COVID-19. And so the WDHB have very kindly given us some funding for digital enablement. So what we've done is we've created a series of like a catalogue of wellbeing sessions and online wellbeing tools that anyone can access. There's no barrier to entry, they're free. It's all about holistic support for wellbeing. It's got all sorts of offerings like art yoga, guided meditation, all sorts of different things that support wellbeing in different ways that we might need to access. Viewers can visit as often as they like. You don't need to be vaccinated. So I'll jump out of this and stop sharing because it's not working. But if you want to visit it, you can go to, I'll put the link in the chat. And we'd love to see anyone who wants to come and join in. So thank you very much.
Kia ora, Jody. Thank you very much. We look forward to getting that link. What a great resource.
Thank you.
Tēnā koe. Okay, Problem Gambling Services, Shayal. Am I saying your name right? You say it right.
Yes,
So
that's correct.
Kia
Tēnā
ora.
koutou katoa. My name is Shayal Mala and I'm a public health worker with the Problem Gambling Foundation. At PGF Services, we provide free, confidential and professional support to anyone impacted by gambling harm. So it's not just for the immediate gambler, but as well as their family, friends, whānau, colleagues, anyone that may be that may feel that they're being affected by someone else's gambling. We do provide support for them as well. And we also work to ensure that we support our Māori clients in a culturally appropriate and mana enhancing way as well. The public health team, which I belong to, we connect in our communities to raise awareness for gambling harm and support community well-being. I can also provide education and training support for staff to identify and screen for gambling harm, and also provide guidance to develop organizational policies on gambling harm. And if you also want, you know, some fact sheets or a little bit more information around gambling harm, about the research that's done, you're always welcome to reach out and I can provide some help around that as well. So thank you very much for this opportunity to let me share. Thank you.
Kia ora, Shayal. Beautiful. Ka pai, everybody. Very succinct, very informative, amazing. Ka pai. So, hey, Zoe, I think we had e tupu e reo in the maternity and child health group. Does that make sense to you, Zoe?
Yeah, it does. Yeah,
Okay.
Tracy and I have been chatting to sort it out. Yeah, and I am.
Pai ana?
Yep, pai ana.
Oh, kia ora, kia ora. Okay, so Jude from Walsh Trust.
Morena, ko Jude Tukuinenka. We have a lot of different services at Walsh Trust. We have community and peer support, which we're probably most known for. We have maternal mental health and a facility dedicated to that, as well as one for over 65, and there's respite bed there as well. We provide tenancy services, not just for our clients, but for anybody. Do a lot of employment services as well. The contract I'm on is an unusual one. It's an MSD contract. It's called Independent Endeavors. And mine is basically engaging people with their community and or employment, but no employment outcome expected. So no pressure that way whatsoever. So I can help people get into volunteer positions, get into work if they want. I'm basically a life coach. Think of it that way. So if you want to refer anybody, I'm doing all my stuff online, mainly blogging. Some of you might get my regular emails already. If you want to be on my list, or if you have a client who wants to sign up, that's absolutely fine as well. And I can keep in touch any way that they prefer. So yeah, all kinds of good stuff going on. We're all obviously triple vaxxed, etc. And we do rat testing before we come in the office. So yeah, that's me. If anybody has any questions, get a hold of me later. No worries. Thanks.
Hi, kia ora, Jude. Kia ora. Wonderful, wonderful to hear all of the safety precautions that are in place in all the different organisations. So kia ora, Jude. Amiria, tēnā koe Amiria.
Tēnā koutou, thank you Hinemoa, and lovely to see you all this morning. So I'm Amelia and I'm from Waves Trust. Waves is what's called a family violence network organisation. So we're not a family violence service provider, but it's our job to coordinate the Waitakere family violence network and provide backbone support to the local family violence sector. So when we talk about the network and the sector, we're referring to a really broad umbrella of agencies. So that includes our NGOs, it includes government agencies such as police, Oranga Tamariki, WDHB, ACC, that includes our family violence specialist providers, but also other social service providers and even providers working in different sectors such as health, education, etc. And that's because family violence is such a large and complex issue that even those who aren't specifically working in a family violence agency will often be coming up against family violence when working with clients. So by being part of our network, practitioners are better able to support their clients. So the main thing that we do to bring the network together is we hold monthly network meetings. So we
There you go, Amelia. Tēnā koe. Put it in the chat, some of it in the chat. And also we are sharing everybody's information after this, so you can keep connecting. Kia ora, Tracy. Hey, Yellow Brick Road, Sonia.
Kia ora, everyone. Can you hear me?
Yes, we can.
Oh, great. Sorry, just having some technical difficulties this morning. So at Yellow Brick Road, our organisation is the main focus of our organisation is to enhance positive change, which is our singular focus. We are a group of support workers that work alongside family whānau. We are not clinicians or counsellors, but we do provide resources, advocacy and information for those families. Our services are free and it is self-referral. We get police referrals, we get DHB referrals. And we actively walk alongside the people we support through the challenges till well-being of the whānau is restored. By this, we have one-on-one group support sessions, we have personal group sessions, we do advocacy, we have family peer support groups. We actually, each DHB has a monthly support group, which is different topics are discussed, and you can just sign in and come onto Zoom and join those support groups. We also focus a lot on self-care, especially when working with a family whānau who has a loved one experiencing mental illness. So we don't do drugs, but if mental illness is the main diagnosis, we will work with their family whānau to ensure that their loved one is taken in order for them to support their loved one.
Kia ora, Sonia. Kia ora. So that's support for loved one, enhancing positive change, and, you know, self-referrals and referrals from lots of different places. So kia ora, Sonia, thank you very much. Tēnā koe. Everybody is doing amazing. I just want to take a second before we move into cancer services and support to just break. Everybody's been listening for 30 minutes now, and I want you to do an ah, just like this. Can you make that shape for me? Ah, e, o. Ah, e, o. One more. Ah, e, o. Aio ki te rangi. Right, so that's awesome. Just breaking that up just a little bit to see who was actually listening, and you all are A students. So ka pai. We're going to move into cancer services and support, and we have 3 organisations from there. Then we'll take a little break to hear somebody, the staff's voice. Is that okay with you, Tracy?
Sure is.
Ka pai. I haven't heard from you, so I think we're doing well for time. Ka pai. So, cancer services and support, please just raise your hand, your virtual hand, or if you hear me and you can't do that, please take yourself off mute. So we've got Bowel Cancer New Zealand. Who's from Bowel Cancer New Zealand? Victoria, that's you. And if you did have your hand raised and you don't need to, please, there's no such word as this, but unraise your hand. Put your hand down. Kia ora. Bowel screening program. Who have we got? Naima? Kia ora. And Cancer Society, please. Dianita? Kia ora. Okay, Victoria, the time is yours.
Kia ora. I'm the Nurse Support Coordinator and Wellbeing Coordinator for Bowel Cancer New Zealand. We're a nationwide charity. We go from right up the top, right down to the bitty bottom, supporting patients once they've been diagnosed with a bowel cancer. So we come in after bowel screening, so once people actually have had all their testing and now have a diagnosis. And we work with people from just diagnosed, we've got people who have been diagnosed a week ago to those that have survived the disease and are 10, 15, 20 years post. So we cover a pretty big range of people. We offer counselling for physio, funding for counselling and physio, sorry. And I also have a couple of coffee groups that I run now virtually because I'm the only one in New Zealand. We have been doing these and they've actually taken off really well. So we're starting to promote those, and we also do workplace wellbeing. So if anyone would like any more information going into any of their organisations and out to their members, please get in contact. Hopefully my details are here, but I will put them in the chat. Kia ora.
Kia ora, Victoria. Thank you so much. You must be very busy. It sounds like you are. So
yeah.
Kia kaha, and thank you. Thank you for keeping to time as well. Okay, nā Emma from Bowel Screening Program. Kia ora.
Tamari, everyone. My name is Naima, and I'm one of the health promoters for the Bowel Screening Program for the Waitakere DHB team. So the Bowel Screening Program, it's a completely free program for those aged 60 to 74 years old. And it's a small little test kit that you get sent to your house. It's super clean, it's simple to do. And basically you'd get a pack sent in your mail with this little guide in it. And you'll need this to just do your quick bowel screening test. It's very quick, just takes about 5 minutes. Just see if I can get the stick out. You just need to take your stick out, take a sample, just the size of a grain of rice, so literally just the tip of that. Pop it back into the tube, make a click, put into the Ziploc bag, into the prepaid envelope that we gave you, and into the post box. It's really that easy. So within about a couple of weeks, you'll get your results back. So free program, easy to do. And even right now, with everything going on around the world and with COVID, we're still up and running. So if you do know someone in your family that is due for a test kit, or if you yourself are due for a test kit, then definitely get in touch with me and I will send you a brand new test kit. If you have one lying around.
Naima, thank you. Get in touch with you for a test kit. Yeah, and we're definitely in a health meeting. We are definitely in a health meeting when we get showing the samples. It's amazing, yeah, the work that you're doing on the ground. Kia ora, Naima. Cancer Society, Dianetta, please say your name.
Kia ora te whānau, I'm Diantha.
Diantha, kia ora.
The Cancer Society, we work with cancer patients and their supporters. The cancer patients, it's before they even start treatment, during treatment, and even after treatment. Bloody COVID is impacting on everything and even how we work, just like you. So nursing, psychology teams, and the volunteer driving services. So volunteer drivers are not able to work out in the community. So what we do is supporting patients who have no other means to get to medical appointments with taxis, nurses and psychology, and even myself as a social worker. A lot of our follow-ups with patients and supporters is virtually or on the phone. Home visits or face-to-face contact is depending on circumstances. It could be clients who have maybe hearing difficulties or extreme distress. So we try and follow up face-to-face, but that's after completing the COVID screening. A lot of us, like I say, are working from home because our nurses are visiting service and generally do operate from home. Our domain lodge accommodation for patients who come from out of town with a support person is at capacity. So there's a lot of people from out of town here attending cancer treatment and staying at domain lodge. And because of all that movement, we do staff surveillance, rapid antigen testing. So we do that like 3 days a week. So that's continuing as well. A lot of things are online right now. So there's a lot of webinars, videos available, even on our website. There's information pamphlets. Our Central District's cancer team run a financial workshop. It's monthly. And that's amazing information as well that's shared. So there's a lot of online resources. And so we're still able to tick that box in terms of sharing information as well. Kia ora, and that's me.
Kia ora, Diantha. Thank you so much for that kōrero and just really acknowledging the shift, you know, as we move through these phases, the shift to a lot of resources being online, a lot of opportunity to engage and to do it virtually. So just acknowledging that we're hearing that a lot as we move through the different services. So that can be challenging, and so just acknowledging you all for how you are, that word pivot, you know, how you are adapting. Okay, ka pai, Tracy, we're going to see if we can hear from any of the staff that are still in the room that haven't yet had a kōrero or introduced themselves. Is there anybody, would you like to raise your hand or just take yourself off mute? Just shifting through the screens now. Is it Ashvini? No, did you raise your hand? No, okay, great. Ka pai, so do we have any other staff that I haven't seen yet? We would love to hear from you or just even see your face. Samantha, yay, you're still here, Samantha. Kia ora, Samantha, just like to give you a couple of minutes or even a minute.
Oh, I won't even need that. I just thought it would be polite to say hello. Yeah, I have two roles at the DHB at the moment. I'm the disability advisor. There's quite a few familiar faces I know from my work in that space. So my role's about trying to support the DHB to be more inclusive and accessible for disabled people. And I'm also currently supporting the Consumer Council, the DHB's Consumer Council. So that's more administrative and just ensuring that the systems are running around that and supporting them to meet regularly. Yeah, so 2 roles in the DHB at the moment, and I've worked with Tracy for a long time. So kia ora, everybody.
Kia ora, Samantha. And Samantha, when you come to these spaces, is there anything in particular that you're listening out for, or?
It's really just, I just like to kind of make sure that I'm current and that I, have information about what's out there in the community. Often people come to me and ask me for information, which I don't remotely claim to know everything, but it's really useful if you know someone who does know something. So it's really just about, being present, just hearing what's going on in the West and out in the community. And I have, previously connected with people after these meetings to get more information. So I find it really useful. Thank you.
Excellent. Thank you, Samantha. So you are connecting with people, you're getting a broad perspective on what's out there.
Yeah.
So that's really great to know, that the usefulness, the meaningfulness of this.
Absolutely.
This forum.
And it's faces to names, isn't it? It's seeing the real people, which is always really lovely. I mean, we're still on Zoom, which is a shame, not as nice as meeting people face to face. But it's certainly better than not having any contact at all. So thank you very much.
Kia ora, Samantha. Thank you for that. We're doing pretty well for time. This is pretty impressive because our first go, this is how we've adapted and changed. But please, we are open to feedback always from you. Always. We're always looking to get sharper. So I'd like to check in just before we move on to maternity and child health. Is there anyone from the community here outside of the services, outside of the staffing? I can see Judy's hand up. Ka pai, Judy. Dan, would you like to raise your virtual hand and go to the top of the screen so people can get an eye on you as well in this very busy 2-screen room? Thank you, Dan. Judy, can you see the reaction button there? No, you're on mute.
I'm sorry.
That's okay. So a couple of minutes if you'd like. Oh, Judy, you have a question or a comment?
Yes, I do have a question. And my question is the fact that I'm really fascinated that nobody's mentioned equity in the cancer service delivery. And there's a fantastic research program that Waitakere is currently doing on lung cancer screening. And I would love you to invite the people, Sue Kringle and the people who are actually leading that. Deborah would be aware of them because they presented and they have a consumer council, consumer advisors who are actually co-designing the intervention with them, because it actually accounts for the most amount of discrepancy in mortality with Māori. So I'm just raising that as something that I think is that you should address in future.
Tēnā koe, Judy. I'm sure we should all address that as a team. So tēnā koe mō te kōrero, mō te whakaaro hoki. Kia ora, Dan. Dan, would you just like to quickly introduce yourself? And then we will move on to maternity, child and health.
Kia ora whānau. My name's Dan Collins. You're probably wondering who I am. I actually, for my day mahi, I work in Phil Twyford's electorate office here in Henderson. So I have a little bit to do from time to time with Tracy and the Waitakere Health Link team. I'm also a board member at the excellent Rānui Action Project, and also a board member at Sport Waitakere as well. So yeah, I guess I like community and I like being involved in it. Just a big shout out to everything that everyone does here, and also really appreciate the opportunity to come and listen and talk together. And so a big shout out to HealthLink for facilitating this. Really valuable, and it's the first time today that I've come to one of these, and I'll probably be a regular going forward, I reckon. Kia ora, and thank you all.
Kia ora, Dan. Thank you very much. Okay, ka pai, I want to check in. Miriam, are you with a service or kei tahara? Yep, ka pai. So shall we move on then? Thank you, Dan. We'll make sure you get your chance, Miriam. Maternity and child health. Are you Man Alive? Is there someone here from Man Alive? If you could raise your hand. Right. Man Alive. Okay, let me check. Yeah, everyone's going like, oh, Jose, is it? And then we have pregnancy help. That's Julia. Julia, is it Julia? I can see Julia and Laura, so it's either Julia or Laura.
It's Laura.
Laura, welcome, Laura. You're going to be after Jose. And then, oh, there's Zoe. Zoe, you're on this time. Kia ora, and just checking in that Miriam, you're okay. You are with, I can't tell what organisation, but we've got community health coming next. Yeah. Okay, halfway. All right. So Jose, welcome. Kia ora, the time is yours.
Hello, everyone. My name is Jose Valdivia, and I'm the youth manager of Man Alive. We have different programs to help kids with counseling and youth as well. At the moment, of course, because of Omicron, we are just offering sessions by Zoom or by phone. But when the situation is normal, we will start going to the office and having sessions in person. Just for vaccinated people, for unvaccinated people, it will continue by Zoom or by phone. So we have offices. The main one is in Henderson, another one is in Panmure, and another one is in Whangarei. So if we get usually clients from Orangatamariki, so all the clients get completely funding sessions. It could be from 6 to 12 sessions, or we can make an extension. And as well, you just need to give us a call. We can send you the referral form. And as soon as you complete the referral form, everything will start immediately. We can arrange a session. The first session is an assessment to see what are the main issues that the boy or the youth need counseling. It could be for trauma, sexual abuse, anger issues, being bullied, depression, anxiety, etc., because we cover all the different things related to counseling. So I will leave the details there on the chat. So if you want to give me a call or send me an email for more information, you are more than welcome to do it. Thank you so much.
Whakatau lava. Thank you very much, Jose.
Okay,
yeah, thank you very much. Kia ora. Man Alive. So now we're going to hear from you, Laura, from Pregnancy Help Auckland. Thank you.
Hi. Hi, I'm Laura. I don't know how many of you have heard of Pregnancy Help Auckland. Pregnancy Help Auckland, I've actually was going to have my other colleague with me, Julia. You probably know her better because she's been here for a long time, but she's not available today. And so I'm the coordinator of Pregnancy Help Auckland, and we offer free and confidential counseling and support women and their partners and whānaus struggling through pregnancy during lack of resources or social support. Our free services are maternity and nursing wear, baby clothing from pram to 18 months, bassinet loans, car capsules loan, blankets and baby gears. We are open from Monday to Friday, from 9:30 to 3:30. During this period of red traffic lights, we are still seeing clients, but we prefer them to ring and by appointments and preferably contactless. But we have been seeing lots of moms coming to see us, and we have been here for them. And we know there are a lot of struggling moms out there. Our layer of clothing are all very well selected. We are putting in the best that we have. They're all donated. They're all pre-loved. Our bassinets are all clean, although they're used. And the baby capsules, we've just recently got some fundings and they're all brand new. Okay, and now we've got some fundings this last year. Very lucky, we are trying to extend our services to Northland because we think a lot of assistance is needed there. So we are slowly but surely penetrating into Northland. So in Auckland, if any one of you need services, just give me or Julia a ring. We're here from Monday to Friday, and we're happy to assist where we can. And sometimes we are doing more than offering pregnancy help. All right.
Ai, tino pai, kia ora, Laura. Thank you very much. Thinking about all our babies at this time as you have a kōrero. Ka pai, thank you, Laura. Ai, e tupu e rea, whānau services. Kia ora, Zoe.
Kia ora koutou. Thank you for having us today. Most of you may know us as Thrive. Once upon a time we were Thrive. Yep, but we've transitioned thanks to Cinnamon, the last CEO. She worked really hard before she left to transition it into a kaupapa Māori organisation. Renamed it through the help of some kaumātua and iwi whātua and paua. And now we are e Tipu Reo Whānau Services. So our mahi is really tautoko young parents, starting from haputanga. Often they will come to us when their hapu youngest at the moment is 14, upwards to 26. Often they're on a long journey with us. We're not an in and out service. They can stay as long as they wish. And often we journey from when they give birth to baby up until, they're feeling confident and strong when baby to go out and do things on their own when they're like baby is 2-3 years old. So it's a nice journey we have with our whānau. And the service that we offer covers the spectrum from health all the way to housing, social development, social support. We do it all. We drive them to midwives appointments. We get them kai, we get them kakahu. We do some antenatal classes. We do the whole spectrum. Whānau violence also, thanks to media, who gives us a lot of support in that area. We're doing more in that area. So I guess whatever we can do to help our young whānau thrive, that's what we do. The other thing we've just initiated is we have a partnership now with Ngāti Pawa. We are across the region throughout Tamaki, but we've got a lot of whānau out here in Waitakere. However, we have developed this relationship with Pawa, and we will be doing more in partnership with, and they would be our korowai in regards to mana whenua in the Tamaki region.
Tēnā koe, Zoe. Thank you so much. Nice to hear the transition too, and the new face and the relationships connected. Kia ora, tēnā koe. Awesome. I'm going to ask you right now, we've done some more listening, and believe it or not, listening can be, is a skill. It's a skill. So we're going to take another break. I'm just going to ask you to give me an A, give me an R, give me an E, give me an O, R, E, O, E, A. Ka pai koutou. Kia ora, everybody still listening. You can see who isn't when you do that. Ka pai. So A-E-O means peace, It's one of the meanings of the word A-E-O. So peace, peace. As we continue through the agenda, we're up to our last sector, and we're going now into community health. So kia ora koutou, those of you who are working in organisations and NGOs and community health. When I call out the organisation, could you just raise your hand, and then we'll be able to see you and see your name as well. We've got a few in this category. So, and we're just about there. Kia ora, Asian Family Services. Ashvini? Kia ora. Community Waitakere? Is Community Waitakere in the room? Someone waving? Miriam! Ka pai, Miriam. Awesome. We'll hear from you as well. Don't worry if you can't find the virtual, raise your hand. It's all good. Okay. Independent Living Service. Oh, you found it. Ka pai. Is it you? Sorry, I'll find out shortly. If you can raise your hand on the reaction buttons, that would be great. It will mean you will go to the top. Samuel, for the age, we've got, where am I up to? Independent Living Services, Real World Living. Real World Living. Kapai, is that you, Robin? Kia ora, Robin. Okay, and then we've got, is that you, Samuel? Kei Konea, Samuel, the Asian Network, the Well Foundation. Someone here from the Well Foundation, please. Yes, Tim. Kia ora, Tim. Excellent. If you find your virtual raised hand, please do that so we can see you all the time during this session. And I think we've had St. John's join us. So if St. John's is in the house, is it Sally? Yep, great. Sally, if you raise your virtual hand, what will happen in your reaction button, if you click on that at the bottom, yeah, excellent. And then we can see you, which is all part of the experience, you see. Kei te pai, okay, ka pai, kia ora koutou, Ashvini, the time is yours.
Morena everyone, my name is Ishvini and I work for Asian Family Services as a public health promoter. So Asian Family Services is a free and confidential counseling service for anyone who is impacted by harmful gambling. This could include the person who is gambling or anyone who is affected by someone else's gambling. Could be a family member, a friend, or any affected other. Alongside our counseling support, we also do emotional support, we do crisis interventions, we also provide a lot of general information, for example, how to navigate through New Zealand health and social systems. Largely, we're involved in public health work just to create awareness and educate people on harmful gambling. We also have a new program which is developed in 2017. It's called ASHA program, and it is a program for our South Asian people living here in New Zealand. And it was developed because there was an increased rate of South Asian people needing help with their gambling problems. Yeah, it is an independent team with counselors and health promoters who provide culturally appropriate support for our South Asian population. Our service is available in 8 different languages: Mandarin, Cantonese, Hindi, Korean, Vietnamese, Thai, Japanese, and English. We're open from Monday to Friday from 8 a.m. to 9 p.m. And yeah, anyone can contact us on our Asian helpline, which is 0800 862 342. And our counselors are ready to help for a free and confidential chat. Thank you.
Kia ora, Ashvini. Beautiful, very concise and very clear. Thank you. Kia ora. Okay, so next we've got Community Waitakere. Kia ora, Miriam.
My name is Miriam Gabriel, part of the Community Waitakere team and working as a community developer with them. I feel like I've come home. I've actually previously come from the health sector, so there's some people on here that it's really great to see. Just appreciating the mahi that you do, and I think Community Waitakere is a really cool portal and connecting with communities to actually let them know what's available as one of the other strands from the many other out there. But Community Waitakere have been around for 30 years, and like Dan, I'm a newbie, first time to the network, and feel like I'm going to be here for quite some time. But I think there's some important messaging that we as an organisation can do for, you know, all of these partners here that are actually at the front face of some fairly challenging things for our communities out there, and just around also that the appreciation around diversity, getting that big discussions around the health sector is around equity, and I think, you know, that's the conversation we also need to be ensuring that we're getting that some really cool messages out there for our diverse communities. So yeah, that's just me. I will put my details on there if anybody wants to chat. We do have a wellbeing wharetapawha action wellbeing plan that we're looking at rolling out from messaging, so I think this will be a great feed for us.
Kia ora, Miriam. Congratulations on your transition and your new mahi with Community Waitakere and joining up all the dots and the people in the organisations. Kia ora, tēnā koe. We have now independent living services. Kia ora, is that you?
Yes, it's Shu, thank you. Hi everyone, 你好. I'm from Independent Living Charitable Trust, and we're a community organization serving our community since 1981. And the services we private include information. So we have a direct contract with Ministry of Health. We work with different agencies to provide generic information for people with disability and the seniors. Another main service we have 3 showrooms around Auckland, Browns Bay, Royal Oak and Botany. We have lots of assistive products like wheelchairs, walkers, you know, just make people's life easier living in the community. In terms of assistive products, if you have a need or group, we do have mobile service, can actually come to you to do the free presentations, you know, to show you the equipments we have. We also have a community service, myself, Shu, and my colleague Miriam, she's originally from Korea, also Joshua, like me, original from China. Also, we have a Moro lady called Mary Gush. So we provide some community services to the people in the community, mainly work with seniors, like Tai Chi classes, healthy family project, healthy seniors, and digital literacy, you know, this kind of stuff. The other thing we have is called barrier-free service, or barrier-free advice services. Barrier-free, you know, like basically say somebody want to build a restaurant or a building, so they need to be considerable for people with disability, like if people in the wheelchairs, how do they access to, you know, the doorway, the bathroom, the height of the bathroom, you know, the car park, you know, this kind of stuff. Yeah, we have staff specialized in that area.
Jill, that is the 2 minutes. So thank you so much for sharing your kōrero. And Jill, if there's anything else, please, can you pop your contact in the chat box? Ka pai. Kia ora. Thank you. We are doing very well for time. So let's see what we've got at the back end of this meeting. There may be some room there. So just saying that we're all doing very well and being very respectful. So real world living. Kia ora, Robin, tēnā koe.
Kia ora. Hey everyone, I'm from Real World Living. I am doing networking and communications. We have 2 sites based in Papakura and in Penrose, but we have a lot of clients that come from all over Auckland. So being in the role I am, it's quite useful to be able to network. We offer vocational services and also have a workability program that started up in Papakura for people that have disabilities over the age of 16. With intellectual, physical or sensory needs, generally with high or very high needs. Marion is also here, who works in transition, so I'll give her an opportunity to explain what she does, because she definitely works in West Auckland, and I'll put my details in the chat box. Thank you.
Marion, you're on mute.
Apologies, thank you, sorry. Good morning, everybody. I work as a student transition coordinator, and I work across the whole of Auckland from Bombay to Tahana. I work with all the schools, I work with all the DHBs and everybody, Oranga Tamariki, Ministry of Social Development and Ministry of Education. So our program is for 16 to 21-year-olds in their last year of school, and we work with families to find a pathway for those students from school leaving to adulthood. And that can be going to tertiary education, university, right through to people needing full-time 24/7 day programs and day services and personal cares. I'll put my contact details in the chat box. We're very happy to help with all families who have young people needing a transition and support services. Thank you, and thank you for listening.
Kia ora korua, Robin and Marion. Tēnā korua, thank you very much. Nice to hear that there's services out there for that age group and that transition time. Kia ora. Hi everybody. So we're Samuel, the Asian Network.
Good morning. I'm Samuel Charles, working at the Asian Network, TANI. TANI is the stands for the Asian Network Incorporated. One of our major activity in relation to the context of this meeting is to increase the accessibility to public health and the social support service, particularly for Asian and migrant communities. So which means we keep working on the promoting your service to be connected to those communities. So we are happy to support you to extend your service or to develop your service to be more inclusive for all. Please feel free to discuss with us. We might be able to help you. Perhaps you can use our newsletter, which is published in different 3 different languages of English, Chinese, and Korean, which is all free to promote your service and program to those communities. On the other hand, as you know, there are quite the lack of or quite limited resources and workforce that are particularly specialized for the needs of those culturally and linguistically diverse communities. So you might have some experience in the past to find those professionals for your Asian client is quite difficult. So we might have information where they are and who can be capable. So perhaps we can help you to clients to get their further support along with your service. So even though we cannot guarantee because some service provision, as you know, significantly scarce or doesn't exist. So thank you. So we look forward to working with you. Thank you.
Kia ora, Samuel, thanks so much. And yes, absolutely. The intention, one of the intentions today is to increase access to services. Yeah, that is definitely for all of our communities, So kia ora, Samuel. Tēnā koe. Ka pai, Tim Haramai from the Well Foundation.
Kia ora, thank you. Let me just share this. So Well Foundation is the official charity of the DHB. So we work across North Shore, Waitakere Hospital, but also community health services. And we partner with both the community and with the health services to just make projects happen that wouldn't happen otherwise. So I actually just wanted to update on a couple of quick projects that you guys would be interested in. So this is the primary birthing unit, which I've presented previously here. So you'll recall that a primary birthing unit, it's a midwife-led birthing option. Actually, at the moment, across North and West Auckland, we have 7,000 hospital births each year and 220 in our rural birthing units. And part of the challenge is they're so removed from our tertiary hospitals that people have this perception that there's more risk involved. So the whole business case here is to have something that is provide West Auckland with an urban birthing unit. And this unit in itself would have capacity for between 400 and 500 births a year, and co-designed with Māori, with Pacific, with teen parents to help address health equity as well. And so on the right-hand side there is where it would be located, out the back of the staff car park, with a separate access onto Busker Mav, with 6 of these amazing units that you can see in the design here, with a birthing suite out the back here with a birthing pool, a courtyard with grass for whānau to enjoy. So it just changed the whole environment for whānau, for birthing options. The challenge is that this cost $10 million. There was no funding available through DHB or central government. So Well Foundation have developed this model with social investors where we will build and own the facility on Waitakere Hospital and lease it back to the DHB over 25 years. This has been worked up and approved by the DHB, but it's now with the Minister for Health for approval. It was submitted in September and we're just awaiting the final notification. If we get that green light, this will be built within the next 18 months and available by the end of 2024. If it's not approved, we go back to the drawing board and we find another solution. And the other project update on is the Waitakere Hospital SCBU, Special Care Baby Unit. So we as a foundation have contributed $5 million to that project. And well, I should emphasize that the community of West Auckland have contributed $5 million to that project. And that is on schedule to be completed in terms of the build by the end of March. Then available for the community, probably open from early June, which would be hugely exciting, completely expand the capacity to keep families local rather than having to be spread out around the region and across the country. I'm sure I've used my 2 minutes, so I'll leave it at that.
Kia ora, Tim. Potentially you did use your 2 minutes, but it's a great update. Yeah, it's a great update to hear about the primary birthing unit and the SCBU, and you know, those are important things and indicators for our community. So thank you for bringing that update to this forum. Kia ora, Tim. Okay, here we go. We're on our last organisation that is on the agenda. And we're going to check in at the end of that and see we've got another couple of updates. So well done, everybody. You're still here, you're still present, you're still listening. Well, that's what it looks like. So congratulations. Ka pai, we are going now to St. John's and we've got Sally.
Hi everybody. I thought I'll just, with my 2 minutes, it's far too much to go over everything, but I'll just explain what my role is, probably is better. My role is a healthcare relationship manager for St. John in the medical alarm division. So my role is to provide information, education and support to health professionals primarily, and that's across everything. That's DHBs, community, NGOs, medical practices. So that's done. I do in-service education sessions and provide professional development certificates for hours. We discuss the medical alarms, and then we can give you some digital resources and some hard resources to help you depending on what you're needing. So we've got our medical alarm brochure in 13 languages, for example, in PDF form. So there's a lot of stuff we can do. So it's about having a chat, building a relationship, what is it that you need, and then moving forward from there. So thank you, and I'll put my details in there in the chat box, and feel free to send me an email if there's anything you want or you just want to have a chat, just give me a buzz. Thank you.
Kia ora, Sally. Thank you. Thank you very much. Excellent. Excellent. Everybody within the time too. So kia ora koutou. We are at the part of the agenda now. There's a lot to hear. There's been a lot to hear. And I just want to acknowledge now that we're at the part of the agenda that is about updates. So, and we have been having updates the whole time, just acknowledging that too. So I'm going to give you the time now, Tracy. Kia ora.
Many thank yous. What a great variety of work that's going on. Thank you, everybody. There's a couple of updates that I wanted to give. Firstly, the foyer update. So there is a refurbishment going on in the Waitakere Hospital foyer. And I was hoping that I could show you the plan that's come out, but it's not quite yet approved. It's very close, but our consumers and a lot of NGOs have also put time and effort into feeding back on what the foyer might look like. So we're hopeful that it's going to have some of the features that were in the feedback from our community network meetings, but I can't show you anything today. So it must be really close. So when I do get it, I can send it out on email for everyone's information, because I think, yeah, it should look great. I do want to update on our foyer refurbishment, and we need Benjamin, are you there, to share the screen? Thank you. So Waitakere HealthLink is building a community health services video library on its website. This will enable health professionals and community to learn about health services being provided in the local area. We have 8 videos uploaded so far, so if your organisation would like to join the video library, just email me your video. We're sort of putting a max limit on it for like 2.5 minutes. So if you email that to me, I can get that uploaded on our website. And we're looking forward to providing a comprehensive list of health provider information in one easy to access location. So once we have a really big library, we could have that and then transform these meetings into something less of a talk fest and more of a discussion, or we'll see where that goes. So that'd be great. The other thing, thank you, Ben, we can take that off now. Thank you. We did, the Executive Committee of Waitakere HealthLink did learn at their last meeting that the master planning for Waitakere Hospital has gone on hold due to the changes in the health sector. So I was just wondering if Kay or David would like to maybe talk about that, because they are on our exec. Kay was chairing our meeting and David was there as well. So Kay or David, would you like to update everybody on what we learned? Nope. You.
Sorry if I unmuted. Yes, I have. Yes, it was a grave disappointment to learn that what we thought was all to go ahead is now not, simply because of the change that's going to happen with the DHBs going out and the new entity coming in. So we are trying to make sure that we, and by we I mean all of West Auckland, all of you who work in West Auckland, need to make a lot of noise to make sure that we go on that first agenda for the 1st of July. I'm sure Judy will be able to help us a little bit in telling us how we can go about this, but we need to be heard. This hospital, as David said at our last meeting, was really, really urgent 5 years ago. And it's even more urgent now. We've got more and more places being built in tiny little areas in West. In fact, where our population is just absolutely exploding, and the hospital is needed twice as much and twice as urgently as it was 5 years ago. So I wonder if Judy might be able to explain a little bit about it and how we
Judy
might.
McGregor's not here. Judy McGregor's not here.
Oh, she's not.
No.
I thought she was coming in. No. Okay. So I think what we need to do is devise some sort of plan where maybe we can have something signed by all the NGOs that goes forward to the Minister of Health and others to put this to them, to say this was urgent, it's more urgent now, we are not going to be put on the back burner, we need this done now and we need it approved. And this is who we are, these are the people we work with, we're the people who know Out West, you don't know Out West. And we need to get that message across. So I'm asking everybody to make as much noise as they can wherever they go, and telling people and getting people to make a big noise about this. And hopefully we might be on their first meeting on the 1st of July. We might be on that agenda, but it has to be done. So hopefully you'll all help with that. And David, if David's still here, he might have something to say?
Just to add to that, what Tracy is referring to, the master planning had gone to the Capital Investment Committee. While they accepted the rationale, they've held back on making a decision, citing the transition to the Health New Zealand, and they would prefer that decision be delayed until Health in New Zealand is on board. And so basically what we're saying as a community is that we're going to craft a letter to the Minister and to all relevant to say how disappointed we are that a decision is not able to be made at this stage, but to be delayed for a significant amount of time, given not only the population growth, but also the crumbling infrastructure. Not very long ago, we've had power outages. The building is just not fit for purpose, and given the incredible exponential growth of the population out here, we just find it as a community that it's not acceptable. And so we're in the process of crafting a letter and requiring all of us to, including our politicians, to kind of communicate the same message to the Minister about the current decision.
So please spread the word. Make sure you speak to your politicians. The more people who are getting onto them about this, the more likely we are to be able to, even if not on that first agenda, but hopefully we will be very near, because otherwise it's not going to happen. Thank you.
So I can once we create the letter to go to Ministry, I can. Am I muted? No.
No.
So once we, the executive create the letter, then we can start circulating for people to support that, and we'll work out how we're going to do that and keep in touch.
Thank you.
Kia
Thank you,
ora.
Henimoa.
Tēnā koe, Kay. Thank you very much to Kay and to David. And that's the updates. Those are the updates. Can I just get an indication? So I see Judy's put might be useful to develop some comms, and then I heard what is happening as the next step. So to share out. Kia ora, Tracy. Thank you for that. Can I just get an indication while we've got everybody in the room, because we're winding down now, I'm about to close our meeting with Karakia. Can I just get an indication, because Tracy gave us an awesome update about the WHL video library, digital library. Oh, they say digital now, not video anymore. So digital library, could you just raise your hand or use a reaction button if you think you would contribute a 2.5-minute video on your service to be uploaded to this library? So just use your reaction, any reaction if you're keen. Yeah, I can see hands. This just gives Tracy a look, a bit of a look in. Yes, thank you, Rachel. Diantha, Kapai, excellent. Okay, there's quite a few. So there may be a limit, so, on time. So that just gives Tracy, is that helpful, Tracy? I've lost you.
That's like 12 more, yay.
Yeah, great. Okay, excellent. Thank you, everybody.
Henimoa,
yes,
sorry,
Kay?
can I just want to ask, I know I've asked these questions before, but because I'm dealing with so many people in groups and they're telling me about the problems they're having with NGOs that don't seem to be in any sort of order with COVID.
Yeah,
so just
2 minutes.
3 questions, and it won't take that. Did you have a crisis plan in place when COVID hit? If you had a plan, how effective was it? And if you didn't have a plan then, do you have a plan now? And with your new plan, can it be accessed from anywhere? I think it's really important. We're in another world now where this can hit at any time. we need the crisis plan for our organisations. That's all. Thank you.
Thank you, Kay. So those are obviously questions to take away and think about, you know, and apply and mull over. Kia ora, Kay. Thank you so much. And tēnā koutou katoa, mō tō tainga mai I tēnei wā. Thank you for your attention, your energy, the sharing of your resource and your service for our wider communities. We do a big mihi, ngā mihi nui ki a koutou mō tō mahi whakahirahira. Thank you for all the work that you are doing in the community. Thank you to the staff who came, and just thank you, Tracy, for organising this all so well. We are actually going to close now, Tracy. I just want to check in with you, Tracy, before I close with karakia. Is there anything you'd like to finish off with?
No, just to say that I will send all the contacts out to everybody, and going forward you'll hear from us about the master planning for the hospital. Hopefully everyone will get behind it. Whatever we're doing, someone suggested a petition, so that's worked well in the past, so love petitions. Sign them every day just about for a while. And thank you Hinima, amazing facilitation as usual.
Kei te pai. Kia ora koutou. So thank you all. Tēnā koe Zoe. Mauri ora kia koutou katoa. I'll just close with a karakia. Me noi tātou. Unuhia, unuhia, unuhia ki te urutapu nui. Kia wātea, kia māma. Te tīnana, te ngākau, te wairua I te ara tangata. Koiara e runga, whakairia ake ki runga. Haumi e, hui e, tāi. Thank you, everybody. Tracy, keep in touch on our network. Kia ora.
Kia ora. Have a good day. Bye-bye.
Ai. Ka kite anō. Kia ora nā.